The Bale-Doneen method recognizes that lifestyle is the most important aspect of heart attack and stroke prevention. To ensure each patient is receiving optimal exercise and diet advice, we measure the ApoE genotype in every patient. This gene determines how someone metabolizes his or her food and responds to exercise.
We try to fine-tune lifestyle as much as we can in that we're all unique, and what we take into our bodies, it really depends on how our bodies are going to break down fats, proteins, carbohydrates. How do our bodies process what we take in? So to try to get the best understanding we can, we look at something called the ApoE gene, which it's a gene found on chromosome 19, and there's 3 alleles to that gene, and of course you're going to inherit 1 allele from your mother and 1 from your father. So based on that, then you have 2 alleles, so you're going to be ApoE 2, 3, 4, basically in a combination of the such, and the recommendations are different. The recommendations really vary based on the gene type.
Prescribed exercise along with a good diet change in many cases is all that is needed. But ApoE gene study provides critical evidence to know if you are at risk and will need life-saving prescription therapy. No one in this program is destined to die because of an inherited gene type. They may, however, need some help along the way with the right combination of statin drugs, beta blockers, aspirin, and niacin.
They gave me the medications to take, which I have been taking, and had the evaluation again a year later, and the results were really good. My cholesterol is down to like 180, my total cholesterol. All the triglycerides, everything is within normal. The one I was most interested in is the reversing of the soft plaque and arterial age, and I'm down to almost my age. I think it was like 65, and he said next year I will be, he thinks, under my age, which is my goal.
The standard of care gives lifestyle and diet recommendations, assuming each patient is reflective of the average in the population studied. Is this standard good enough for you?
So the Bale-Doneen method has utilized genetics for almost over a decade now, and we've used it in the form of measuring ApoE genotypes to help further guide individualized lifestyle advice. And we're thrilled now to have the opportunity to use decode genetics and even broaden our array of genetic testing to get very personal and individualized with each person that comes in through the center. So it certainly has enhanced what we do.
Understanding a person's unique genetic makeup through genetics tests can reveal if that person has inherited a higher than average tendency for developing certain diseases. Having a higher than average tendency for developing a disease does not mean we will develop that disease. Other factors such as lifestyle and environment play an important part in determining who gets ill. But knowledge is power. Understanding your individual level of inherited risk for developing certain common diseases gives you an opportunity to do something to reduce that risk. Dr. Bradley Bale and nurse practitioner Amy Doneen of the Heart Attack Prevention Clinic believe that genetic testing can be an important step in preventing disease and that Decode Genetics is uniquely qualified to do the work.
Having genetic knowledge is at the core of trying to personalize medicine. You can't get any more personal than knowing your genetic makeup.
What the genetic testing has allowed us to do here at the Heart Attack and Stroke Prevention Center is just boost up our ability to be more individual in our care.
Decode Genetics is a global leader in the field of genetic research. They have created tests that measure an individual's risk of developing certain diseases. Here are some examples. Decode currently offers Decode T2, which assesses genetic risk for developing type 2 diabetes. Decode AF tests for risk of atrial fibrillation, a condition that may cause the heart to beat too fast, too slowly, or irregularly. Decode MI tests for an increased risk of myocardial infarction or heart attack, especially in men under 50 and women under 60. Decode also offers Decode Me, which is an overall examination of a person's genetic makeup. Decode Me measures 1 million SNPs on your genome and assesses genetic risk for close to 30 diseases, including all those just mentioned. The results are securely stored, and up-to-date information about your profile is provided to you as new discoveries in genetic research are made.
Well, the way it works is you send us a sample from the inner cheek of your mouth, and we then take the DNA from that sample and we measure up to 1 million different DNA markers. And then what we do is we annotate those markers and put them in the context of disease risk for certain common diseases. So you have a personal profile about which diseases you're at higher risk for based on the information that comes from your DNA.
Decode is continually improving the number and scope of its tests, which increases the value of understanding your genetic information. Decode Genetics operates the largest, most advanced genetic research facility of its kind in the world. Supported by renowned scientists and backed by years of experience, Decode has an unrivaled track record in locating those areas in human DNA that influence a person's risk of developing certain diseases. Decode Genetics has analyzed DNA from more than 300,000 people around the globe. Decode has also compiled a genealogical record for the entire population of Iceland, stretching back over 1,000 years. By examining this information, Decode is able to continue to link specific genes to individual diseases. Decode Genetics is a world leader in conducting this type of analysis, and every Decode test benefits from this extensive knowledge and experience.
Decode Genetics has a long history of finding genes for some of the most common diseases. We have a long track record. Furthermore, we've spent a large amount of time dealing with personal privacy issues, working on informatics and security algorithms to make sure that genetic information and medical information that resides within our computer systems here in Iceland remain secure.
Testing begins with collection of a DNA sample from the individual. Decode uses a buccal or cheek swab to painlessly gather skin cells from the inside of a person's mouth. The samples are sent to Decode's lab, and results are returned in only 3 weeks.
It's a super easy test to do. I mean, it's ridiculously easy. So in terms of doing it, it's like a no-brainer.
Once the test results have been returned, the patient, together with a physician, can initiate lifestyle and/or medical changes to address the risk for certain diseases.
When we got the results back after sending my kit in to the Decode Genetics, is in my case, I was 88% higher than the average to have diabetes. We've almost totally reversed that.
This gives you an opportunity to empower the individual, in the case of Decode Me, to be able to do something to better their lives.
Doing genetic testing can alert you to what you're predisposed to develop for major healthcare problems. And there are always things that can be done in terms of prevention.
It's important to understand that these are risk assessment tests and do not determine who will or who will not develop a particular disease. At the same time, understanding risk can empower prevention. A better and more personalized understanding of risk can help individuals and their physicians implement rigorous strategies to reduce the risk of developing disease.
Why would not everyone want to do this? Why would they not want to do the testing? It just seems like a clear-cut answer. Everyone should be doing it.
This is an investment in yourself. This is not in the category of spending money.
I'm not trying to prolong my life necessarily. I'm not afraid to die. What I'm trying to do is have quality of life while I'm here.
You can never, ever regret what you invest in taking care of yourself. I mean, you have one body, one life, one chance. Whatever effort it takes to stay healthy is absolutely worth the time or investment that you take.
Bradley Bale and nurse practitioner Amy Doneen, co-founders of the Bale-Doneen method, are having their work recognized both nationally and internationally. Both Bale and Doneen presented data at the International Symposium of Atherosclerosis, June 2006, and again in 2007 in Helsinki, Finland. The Bale-Doneen method has demonstrated the ability to identify silent, potentially deadly arterial disease and to effectively administer global risk factor assessment and treatment. This resulted in significant regression of the arterial disease. This is the first time this has been shown in a private non-university clinic. The Bale-Doneen method proves that heart attacks and strokes can be prevented, and the disease can be reversed. The Bale-Doneen method is having an impact on many lives and can impact yours and add years to your life. Each participant should take full advantage of the program by following completely the custom-tailored program that will be provided you. During the next visit, patients are given a detailed report of their IMT scans and other tests that have been ordered. They will understand what gene type they are and which activities, habits, and diet elements are causing their disease. They will understand insulin resistance and how to overcome it. If there is an iceberg out there, it can be avoided now with the Bale-Doneen program. If someone has already hit the iceberg, damage control and even repairs of arteries can be achieved. It will take a lifelong commitment on their part, but it will be worth the effort. Families and loved ones will be grateful, and everyone's chances, outlook, and hope for a better life and future will be greatly improved. Some old habits will need to be abandoned and new, healthier habits adopted. It's true some of us take better care of our cars than we do our own bodies and think nothing of regular oil changes, tune-ups, and occasional needed repairs.
Some of the critical testing we do isn't always covered by insurance. For example, that carotid ultrasound that we feel is an essential piece of information, sometimes insurance companies pay for it very well, sometimes they don't. What's a $175 to $200 test? You don't think anything of taking your car in and getting it tuned up or getting the oil changed and the brakes looked at, etc. I know when I do that with my car, the bill, I'm happy if it's only $200 and I'm happy to pay it. But it's like people feel like, well, I've got insurance, so I'm only going to do what the insurance covers. Well, look, we all have car insurance, don't we? Or hopefully most all of us do. We don't expect our car insurance to pay to change the oil and to check the brakes, etc.
The small amount of funds required for this prevention program is insignificant when compared to the cost of catheters, peripheral intervention, and open heart surgery. Having a way to see the potential collision ahead is where the medical industry is heading and where it should be.
You know, right now we have certain movements with youth obesity and different things that we're trying to correct. And I think Dr. Bale just has a really good message that if you start at it young, you won't have to encounter some of the problems later in life.
By having this program here, we have an opportunity to impact the lives and the health of that many people. So I think it's a great opportunity for the citizens of this area to have the benefit of Dr. Bale's experience and expertise in helping to prevent some of the major killers in America.
Thank you for your participation in the Bale-Doneen method of heart attack, stroke, and diabetes prevention. You are one of many throughout the country who want to head off and beat this disease. The Bale-Doneen method, when carefully followed, can have a major impact on your future.
It's really been drastic for me. It hasn't been just a little problem. It was huge. And the results have been huge.
I can attest for the program that I'm on. In my situation, it's worked. It amazes me.
He has attacked this from every angle, and that's why he's successful.
Let's head it off before. Let's make the quality of your life the best it can possibly be for as long as it can be.
Why wouldn't you come and see Dr. Bale?
And what have you got to lose? It's relatively inexpensive.
And I encourage people who go through strokes, don't give up. Give it your best. And by the way, go see Dr. Bale. Don't let one of these things happen again.
And we have the tools, it looks like to me, to prevent a lot of cardiac disease.
It's a lot easier to take a pill than it is to have an operation.
Well, I just want to say that you've taken a proactive stance in regards to your health, and the great thing is taking a proactive stance with prevention can keep you free from vascular sequelae. That's the beauty of this. So I tell anyone that takes the step to find out if they have risk, to know that that risk is treatable, and they really need to take a lot of comfort in that. It's treatable, and so I commend people for actually coming out there and trying to find out if they have risk or not. It's a wonderful opportunity.